Hey there, I'm Dr. Austin Perlmutter. In this video, we're going to explore some of the recent science of stuckness. What does the recent medical literature say, and what do recent articles say about how our brains and bodies are getting stuck, and what does it tell us about how we can get the stuck out? So there are three different articles I'd like to cover today. The date is April 25th, and all of these articles have been published in the last few weeks. The first article concerns depression, which, as I've said before, is one of the kind of prototypical states of stuckness in the brain. So, this article was a systematic review and a meta analysis that was published in JAMA Psychiatry on April 13th. It's called Association Between Physical Activity and Risk of Depression, a systematic review and meta analysis. So, in papers like this one, researchers are trying to get a broad sense of the literature on a specific topic. And by reviewing that literature, all the different studies that meet their criteria, they can have a better sense as to whether there is an association than what you might get from an individual study. In this study, the researchers were primarily focused on the association between physical activity, aka exercise, and risk for depression. So they actually looked at studies that combined over 191,000 people when you put them all together. And that was over 2.1 million person years. The big takeaway from this study is that when they looked at people's exercise or physical activity and risk for depression, they found that even people who were doing half of what is recommended as far as a weekly exercise routine had a significantly lower risk of depression, and that was an 18% lower risk of depression. And people who were getting the recommended amount of exercise per week, which is 30 minutes, 5 days a week, had a 25% lower risk of depression. So when they put all of this together, they said that, quote, this systematic review and meta-analysis of associations between physical activity and depression suggests significant mental health benefits from being physically active, even at levels below the public health recommendations. Health practitioners should therefore encourage any increase in physical activity to improve mental health, end quote. This is really important stuff because as it relates to mental health, for the most part, we've just been looking at prescribing medications or using therapy once people get to the point of having depression. And the idea that we can leverage lifestyle intervention, in this case, using exercise as an antidepressant strategy, is really powerful stuff. So again, study number one suggests that there may be an antidepressant effect of exercise for people who may be at risk of developing depression. Okay, let's move on to article number two. This one is not a scientific study, but it's an article that was published on April 21st in the New York Times called Can Certain Foods Really Stave Off Dementia? So this article explores whether food can be seen as an intervention as a prevention tool for dementia, specifically looking at Alzheimer's disease, which is the most common form of dementia today. It starts off by talking about the fact that there are really no good treatments for Alzheimer's disease, and that includes pharmaceuticals as well as other interventions once people have the diagnosis. Then it looks at certain dietary strategies that may be effective in preventing Alzheimer's disease. It specifically calls out two dietary patterns, and these are the Mediterranean diet and the MIND diet. The MIND diet is newer than the Mediterranean diet because the MIND diet is actually a modified version of the Mediterranean diet that was developed by researchers specifically to help combat dementia. So the MIND diet stands for Mediterranean Intervention for Neurodegenerative Delay. And DASH is actually another acronym for Dietary Approaches to Stop Hypertension, which was a diet that was originally developed for hypertension or high blood pressure. So there's a lot of similarity between the Mediterranean diet and the MIND diet. They prioritize things like leafy vegetables and berries, nuts, olive oil, whole grains, fish, beans, poultry, and a little bit of wine. But the MIND diet actually recommends against any sorts of red meats and also cheese. Some people will incorporate cheese and some red meat in a Mediterranean pattern diet. Mediterranean is a bit more of a broad diet than the MIND diet seems to be, because the MIND diet is really eating more of these 10 foods that may be helpful to improve brain health and minimizing certain foods like red meats and cheese that may be bad for our brain health. As one example, however, in 2017, a study was published comparing the mind versus Mediterranean pattern diet in almost 6,000 US adults. And it showed that either of these diets was associated with improved cognitive function, in that there was a lower risk, up to 35% lower risk of cognitive impairment. And the last thing I'll say from this New York Times article is that they call out the benefits of fish, specifically fish that are rich in omega-3s. We've long known that omega-3s are kind of a key fat, and actually the most common fat that's found in the brain. And it seems to be really important for cell membranes as well as for the immune inflammatory balance in our bodies. And they talk here about the benefit of omega-3s in food form, but not in supplement form. And overall, they recommend trying to get your nutrients from food rather than supplements as it relates to brain health, which does make a lot of sense to me. The last article I'm going to discuss today is another article on the topic of depression. This article is called Antidepressants and Health-Related Quality of Life for Patients with Depression, Analysis of the Medical Expenditure Panel Survey from the United States. It was published in PLOS One on April 20th of 2022. This article sought to understand whether people were getting an objective benefit by subjective scores, but whether people were getting a benefit in quality of life if they were prescribed antidepressants and they had depression versus people with depression who were not prescribed antidepressants. And the way they did this is they used data from the United States Medical Expenditures Panel Survey, which is a sampling of United States households. And they looked at data from 2005 through 2016. They looked at people who were depressed, who were either prescribed antidepressants or were not prescribed antidepressants. And this wasn't controlled for, let's say, severity of depression. Rather, they were simply looking at people who had depression who either were or were not prescribed antidepressants. And they had a pretty big sample size, about 17.5 million people they were able to sample each year of this. They followed these people for about 2 years, and they looked at whether they had had significant improvements in certain quality of life scores. These quality of life scores were segmented into physical as well as psychological or mental. So the psychological distress and psychological well-being were incorporated in the mental quality of life, and then the physical function, energy, and vitality were the things that were reported in the physical quality of life score. What the research showed is that people who had depression, who were prescribed antidepressants, didn't have statistically significant benefit in these quality of life scores compared to people with depression who were not prescribed antidepressants. And there have been some concerns about this study in that it wasn't controlled for people who had maybe more severe depression and the like. But the big result of this research is that it didn't seem like there was a huge benefit to quality of life as a result of antidepressant therapy. And so the researchers do call for more in-depth analysis of this, but it does build on some of the concerns that antidepressants, perhaps as a therapeutic modality, may not be quite as effective as standalone therapy as what was previously believed. And it builds off of research suggesting that perhaps antidepressants may not be a whole lot more efficacious than placebo. So if you've heard me talk about this before, I have mentioned that I think antidepressants are important therapeutics to have available, but it is important for us to continue to investigate exactly how efficacious they are. And I think whether there are alternative therapies such as exercise, certainly looking into things like psychedelics in the right populations, that we should be considering as alternate strategies for people who may not benefit as much from conventional antidepressants. So these are the 3 studies or articles for this week. I hope you've learned something here today. And if you're interested to continue to learn more, make sure you sign up for my newsletter, where I'm going to be putting out information on these types of topics. I hope that you have a phenomenal day. I'll talk to you soon.